Hey guys. So earlier today, I had my phalloplasty appointment with Oren Ganor at the Boston Children's Hospital in Massachusetts. So I'm just going to go over how that consult went, what I learned from it, and what my next steps are. So the first thing I learned is that he does everything in two stages. The first stage, he does the scrotoplasty, glandsplasty, phalloplasty, and urethra lengthening. And in stage two, which is 6 to 12 months after, depending on which ones you get. If you get the testicular implants only, you can get that 6 months after. But if you want the erection rod or erection device, that's a year after the first surgery. I also learned that it's 10 hours long. Um, I learned that they're very different when it comes to hospital stay. So, in total, you're in the hospital for almost 2 weeks. And for two of those days, you're in the ICU, which is normal. But you're in the hospital for almost 2 weeks, which I guess they really want you to make sure that you're okay to walk, stairs. You start physical therapy in the hospital, like all that stuff before you leave. I've heard of a lot of guys talk about on YouTube that they get up and they walk to their chair the first day or the first time, and then they get up the next day and they walk a little bit, and then that same day they leave. This hospital doesn't do that. Boston Children's Hospital doesn't do that. They get up, they have you walking around, you work with a physical therapist, they make sure that you can walk upstairs, they make sure that like there's no complications, and so they keep you there for like almost 2 weeks, which I know I'm gonna hate it when I'm there, but I also really love it because I want to make sure that I'm really good and that I have a whole bunch of people around me if something goes wrong, they can take care of me. So I think that's pretty awesome. They did say that after my surgery, I will have two catheters. One super pubic tap catheter, which is that'll be like out of my bladder. I don't know why I'm pointing; you can't see, but it'll be out of my bladder, and that's what I'll pee out of. First, it'll be a bag, and then I'll upgrade to a little cap, and I'll pee standing up for the first time, but kind of cheating because it'll be out of a catheter. So that'll be 4 to 6 weeks, and then I'll have a full catheter out of my phallus, and that'll be for 4 weeks, and that's just to make sure it's healing correctly before they take it out. Um, Also learned about bowel prep, which I kind of knew a little bit about, but 2 days before surgery, I'm gonna go on a liquid diet, so I can only have liquids, and then the day before surgery, I eat or ingest or drink or something, um, the stuff that makes me poop, pretty much all day. So that's what I do there. I learned that the complication rates for like serious complications, meaning like you lose part of the phallus or the whole entire phallus, is like less than 1%, which is really good. And then for fistulas and strictures, complication rate is like 50% or like 1 in 3 people, which he said it's not that bad because it's if you need surgery for it, it's a really minor surgery and it's like day surgery. You're in, you're out, and it's not that bad. I also learned that like for sensation, the nerves. Sorry, I just moved everything. Sorry. For sensation, I learned that the nerves grow apparently 1 millimeter per day, and sensation and erotic sensation you start to feel it around 3 months, and it takes 9 to 12 months to feel it completely, and it starts at the base. So you start feeling at the base first to the tip. And that's also why you can't get the erection rod for him through him until a year because they want to make sure you have complete sensation up to the tip before they can let you have the erection rod. That's just how they do it there. Um, so for me personally, my next steps before surgery is electrolysis. I have tattoos on both of my arms. I should have thought that through, but I didn't. I did not know that I was going to get this surgery, obviously, before I got tattoos. I'm going to have a tattooed dick. That's just going to happen. But I wanted to do my right arm. I'm a lefty. I want to do my right arm because I have less tattoos on this arm. Like this whole side is tattooed, yes, but not on this side. This side I have this and this side, not up here obviously, but so I want to do this this side, but I also have scars on this side from like self-harm scars. I wasn't sure if I was able to use that. He says because I have great blood flow or something through this arm. He checked it, and because my scars are like surface scars, that he could still use this arm. So that's really great for me. Um, I found out I don't know if you can see this. This is a diagram of where the skin they're going to be taking. So the U is what makes your urethra, which is what you pee from. So if you look at your pinky, this, for your pinky down, that patch of skin is what makes where you're going to pee from. The rest of your skin is making your phallus. So that's what's going to be taken from my arm. So my pinky, this patch of skin is going to be my urethra, like right here, pretty sure. Which, if you look, I don't really have much hair there, because they said that that's the most important place to have no hair. So if you do electrolysis, you want to start right here, because it's supposed to have the least amount of hair, because you don't want to have hair in your urethra, because that's not great. So next steps for me is electrolysis. For me, I had to ask my surgeon's secretary or something to email me a letter saying that I need electrolysis and that's medically necessary for my surgery, so that my insurance will hopefully cover it. I haven't sent it to my I haven't sent it to my insurance yet, but hopefully they'll get it through. In my policy, it says if it's medically necessary, they'll cover it or reimburse me. So hopefully that's true and they'll do it. Also, I need 3 letters from my healthcare providers stating that I am trans, pretty much, stating that I'm healthy mentally, and that I understand all the risks and seriousness of the surgery that I'm getting. And after that, I send them out to my insurance, and I send them to my surgeon, and then hopefully everything will be fine. They'll both accept it, and I'll be able to move forward with surgery. Also, for me, personally, my BMI has to be down to 32, I was told. So I have to lose weight. I have not heard of another trans person, at least that's when talking about their phalloplasty journey, that had to lose weight. Unfortunately, I do. I have to lose 20 to 40 pounds I have to lose. So I gotta do what I gotta do, I guess. So I'm gonna try really hard. Not really try, I have to do it. I don't really have a choice. I need the surgery. So yeah. But yeah, about electrolysis, it can take 6 to 12 months to completely remove the hair. So yeah, and I also have to book my hysterectomy. I have to do that at least 3 months before my surgery. So once I have my electrolysis going, and once I have my hysterectomy booked, then and all the letters are in and stuff like that for my insurances and stuff, then I'll have my actual surgery date, and then I can go through with that. And I think that's it. I have a whole bunch of stuff here. That's why I'm looking down all the time. There's one part that I don't know how I'm going to deal with, honestly. But I have to do a second consult. And it's a consult / exam with all the surgeons. Apparently there's 3 surgeons that work on you during phalloplasty. And it's it's an external exam, but it's an exam. It comes with your body and stuff. I'm not a fan at all, whatsoever. I haven't had an exam like that since I was a kid. So I'm really not happy about that. But the people that I was talking to at the children's hospital, they were very understanding about how it's really uncomfortable, and they were saying that I completely can take over everything about it. I can talk about who I want in the room at the time. Yes, I have 3 doctors. They don't all need to be in the room at the same time. I can have one at a time, or if I have 3 male doctors, I can have 1 male doctor at a time and a female nurse. I can kind of do whatever I want to make sure that I'm the most comfortable as I possibly can be. Honestly, I can't think of yet of a scenario where I'll be even a little bit comfortable. They told me to talk to my prescriber, asking for some kind of anxiety meds to take right before my my appointment to kind of calm me down, which I might have to do. But yeah, that's basically all the information I can think of. Oh, I forgot one thing. I forgot about the size. So they said the size of my phallus would be between 5 and 5.5 inches, which is exactly what I want since your phallus does not get any bigger or smaller. You're packing with it. It's the same size no matter what. If you're just walking down the street or if you're having sex, it's the same size. So 5.5 is ideal, at least for me. So I'm happy about that. And I think that's about it. I'll keep you guys updated. If you have any questions, leave them down below, or you can tweet me. And yeah, I'll be trying to put out more videos just about random stuff that has to do with kind of like phalloplasty stuff. I'm not sure if I want to do videos about me like weight loss stuff. I don't know if anyone would be interested in that. Just like my weight loss journey through phalloplasty, because I think maybe I'll be more motivated if I have other people that keep me accountable and stuff. I don't know if people are interested in that. If you are, leave a comment down below. But yeah, thanks for listening. Okay, bye.